Hello, everyone. You are welcome to UNMASC Lifestyle, and I'm Chinwe here. This is UNMASC second anniversary sharing breast cancer awareness with you. And today, we are blessed to have the honor of a preventive medicine specialist with us. So I am just going to, without further ado, I'm just going to go ahead and invite our special guest, Dr. Ifeoma Achebe. So, welcome, Dr. Ifeoma Achebe.
Thank you, Chinwe, and I hope you can all hear me. Welcome everyone to this session. I'm actually excited to be a part of this event today. As you all know, October is Breast Cancer Awareness Month, so I'm delighted to be here. I'm Dr. Ifeoma Achebe, Preventive Medicine Specialist practicing in Alberta, Canada. And so I'll be the one taking your questions today. Just a disclaimer that I'm not representing any organization in giving this talk, and I'm also not receiving any kind of compensation from holding this presentation. This is just a voluntary effort on my part to help raise awareness on breast cancer. So, like you all know, Breast Cancer Awareness Month is October, and this is a month where we celebrate the survivors in our midst. We also push to educate people on breast cancer, especially the importance of early detection. Um, we also try during this month to advocate for more resources on breast health, so things like access to screening, treatment, and so on and so forth. So I'm really delighted to be here. Thank you.
Wow, what a great beginning. That is fantastic. Thank you so much. I am so honored to have you in this channel where we talk everything healthy lifestyle, from exercise, food, education, to help people grow and live healthier. And who else to help us navigate this process? When I was talking to you about this, I didn't know you were a preventive specialist, medicine, preventive medicine specialist. But then when you told me, I'm like, oh my gosh, that is even fantastic. So I am so honored to have you here today, and I'm sure the viewers here will be very glad to have you in our midst. So thank you for coming. So we are just going to go ahead. I have a few questions for you, and I'll just give a little bit of how it's going to work today for us so that I know, because as a medical doctor and you're passionate about healing people and making sure people live healthy, I'm sure you would like to get questions from the audience as well.
For sure.
So as we go through the questions that I have, I'll be checking out for in the chat to see, and I'll call your attention to any questions that may be coming up in the chat. So, so my first question for you today, Dr. Ifeoma Achebe, is what is breast cancer? Could you tell the viewers in simple terms what it is?
Okay, so I guess that's a good place to start. So thank you for that question. We need to make sure that everybody understands what we're talking about today, which is breast cancer. And so breast cancer is a disease in which cells in the breast grow out of control. There are different kinds of breast cancers depending on the origin of the cell within the breast. The breast cancer can begin in the lobules. Lobules are the glands that produce milk, and in that case, it's called lobular carcinoma. It can also start in the ducts. The ducts are the tubes that carry the milk, and then it could also be the from the connective tissue, which is, the tissue that holds the glands, the ducts all together within the breast. But the lobular and the ductal carcinomas are the most common types of cancers that we see, breast cancers that we see, and that's where most of our cases come from. Yeah, so when breast cancer comes, If it's not detected early enough, it can spread to other organs through the blood vessels or the lymphatic system. And when that happens, we say that it has metastasized, meaning that it's now a metastatic breast cancer. And so, breast cancer that is metastasized has really gone far, and um, in terms of staging, and so requires much more aggressive treatment. And talking about staging, when there's a breast cancer or diagnosis of breast cancer that is made, the next thing that physicians do will be to stage it. So the staging would, you know, help to determine what stage the cancer is at. So there are 5 stages: stage 0, stage 1, stage 2, 3, and 4. Stage 0 to 3 are much more manageable, and so about most of the breast cancers, or about 99% of the breast cancers diagnosed in those stages, would survive the 5 years after their initial diagnosis. So that is why early detection is very key to breast cancer prevention. And I think we'll be talking about
Hmm.
prevention as we go on. Yeah.
Okay. Okay. Thank you so much. Wow, that is so detailed. Oh my goodness. Really appreciate that, doctor. Thank you. So, since it sound as I was listening to you, everything was leaning more towards you were talking about the cell that produce milk and all this kind of stuff. So, I guess that leads us to the second question that I have. There has been a whole lot of conversation, as you know, around breastfeeding. And
Hmm.
my question is: does breastfeeding decrease the risk of breast cancer?
Okay, so yes, studies that have been done in the past continue to show that women who breastfed their kids um, would usually have a reduced incidence of breast cancer in their lifetime. So breastfeeding is highly, highly encouraged in women, unless if there's a serious contraindication to breastfeeding, which sometimes happens. But it's really encouraged that women breastfeed because we're finding that there are more cases of breast cancer later down the years in women who never breastfed or who
Hmm.
didn't breastfeed. Yeah, so it has a protective effect somehow.
Oh wow,
Yeah.
that's very interesting. Thank you. So we're going to just proceed to until we get any question from the chat. We will just proceed with the questions that I have. So, what about smoking? What is the effect of smoking on the development of breast cancer? Is
Good
there any?
question.
Yeah.
So, smoking, we all know that smoking is a risk factor for some cancers that are very obvious, like lung cancer, right? But generally, smoking has been linked with a lot of cancers. So, like I mentioned earlier, when the cells start changing, and if the person is a smoker, smoking can aid that skin cell change that eventually leads to cancer. So smoking can contribute to incidence of breast cancer. And smoking is not good for anything, honestly. It's not good for anything at all. It's linked to different kinds of cancers. A lot of people know that it's linked to lung cancer, but it's also linked to things like, breast cancer.
Hmm.
So it's never a good thing to smoke because you're exposing yourself to cancers and cardiovascular diseases and stuff like that. Yeah.
So the best thing would be not to start, doctor. Like,
Not to start smoking is not. There's really no benefit to smoking, honestly.
yeah, once you
It's
start, when the
one
addiction comes in, then it becomes tougher.
Yes, and then once it starts, if there's any smokers here that want to stop, these days there's a lot of help for people who would like to stop. Talk to
Mm.
your doctor. There are medications that you can start taking that will block your urge to even crave cigarette. So it's much more easier to quit now than it was 15, 20 years ago.
Mm.
Yeah. So talk to your doctor. Your doctor can help you. There's even some low dose antidepressants that can help you to quit
Oh,
smoking. But
really?
just talk to your doctor, and then the doctor will put you on the right one for you. Yeah.
Wow. Oh, I didn't know that. That's
Yeah,
interesting.
it is.
So we're going to proceed. Okay. Are you saying something, doctor?
No, I'm good. Mm.
Okay. Okay. So so the next question is, if let's say a doctor says that someone has dense breast,
Hmm.
so does that mean, or would that mean that the individual would actually have breast cancer?
Yes, so that's always a report that we see on mammograms. Mammograms are X-rays that we do on the breast to screen for breast cancer. So sometimes the mammogram report would say that the individual has dense breasts, and what it just means is that this individual has more connective tissue than fatty tissue. So, like I mentioned earlier, we have different, tissues within the breast. We have the fibrous tissues, we have the ducts, we have the lobules, and then we have the fatty tissue, right? So, if the connective tissue is more in a particular individual, and no two individuals are the same, right? It's just like seeing someone that is slim and someone that has some weight. Yeah, so we're all genetically different from each other. So some people would have bigger breasts than others. Some people will have denser breasts with more connective tissue than others. So when that happens, if you have that dense breast, it can sometimes mask any tumors on mammogram. So the tumors will not be very visible, especially those small ones that the mammograms would usually identify. The density of the breast will make it difficult to be picked out, um, you know, by the mammogram. And so, because of that, it is now said that women with dense breast are more likely to get breast cancer because that initial diagnosis could be missed because of the
Mm.
connective, tissue. But what I tell individuals who, or patients who are in that category of having dense breasts, is that they should look at their risk level.
Mhm.
And if you have a first degree relative who has had a breast cancer, then you consider yourself high risk. Okay?
Mhm.
So, by first degree relative, I mean if you have a mother or sister or even a daughter who's been diagnosed with breast cancer, then you term yourself to be high risk, and mammogram may not be sufficient for your own
Mm.
screening. So you should talk to your doctor about doing this, further testing like a breast MRI. Breast MRI is a much more sensitive kind of imaging that shows the breast tissues from all angles, and the quality is much better than the mammogram. So that way, no cancers can be missed.
Mm.
So yeah, so the people with dense breasts are more likely to get breast cancer because it can be missed.
Mm.
So I hope you understand what I mean. So because of
Yes.
the possibility of missing it because of the density of the breast, not because of anything else.
Mm.
Yeah.
So how do you actually identify? How would an individual know that they have dense breast?
So when they do a mammogram, which is the X-ray of the breast,
Okay.
the report by the radiographer or the radiologist would usually indicate. that the density was high and that they couldn't look at it in its totality. So it's usually included there, and so and what it means is that they will say, okay, suggest breast MRI if high risk, or repeat the mammogram more frequently.
Hmm.
So yeah,
Wow. So,
yeah.
in other words, you have to do the mammogram to be able to identify how dense one's breast is.
Correct. It's part of the thing that the mammogram is looking for. They will look
Okay.
for the density. They will look for any tumor or any abnormalities in tissues and structure within the breast, and
Okay.
then they will report on that.
Wow.
Yeah.
Wow. Thank you. So let's continue. Now the question is, at what age would you recommend that an individual, should start screening? And what type of screening? I know you had said mammogram, and you have actually touched the second part of this question. So
Yeah.
what age, at what age?
So right now, most developed countries would say that screening starts at 50.
Hmm.
So between at 50, so women that are between the ages of 50 and 74 should screen every 2 years with a mammogram.
Hmm.
Um, but we've also seen that black women usually have their onset of cancer in their 40s.
Hmm.
So yeah, breast cancer is mostly premenopausal in blacks, whereas in whites, Native Americans, Asians, Hispanic, the incidence increases after menopause, so from 50 and above. So because of that, a lot of black women are die from more black women die from breast cancer than white women at that age. And so what I recommend again is looking at your family history. So the very first thing that you should know is that if you have a first degree relative, like I mentioned, you look at what age that your first degree relative had cancer. Say, for example, your mom had cancer at the age of 52, or was diagnosed with cancer, or died from cancer at the age of 52, something like that. You should start 10 years before that time to screen. So
Okay.
you would start at the age of 42 to start screening.
Hmm.
Okay, that's what I tell individuals. And once you tell your doctor, I have a family history, I need to start early, they understand.
Hmm.
So you will start at 42 if you have a family history of a relative that had it at 52. So
Hmm.
that is the way it goes. And if it's 55, you go back to 45. So early detection in breast cancer is key. And
Hmm.
so that's for the mammogram, which is the mainstay of screening. The other
Hmm.
kind of screening that I think we all should engage in is the breast examination.
Okay.
So every woman should try to get familiar with what their breast looks like.
Hmm.
So you need to get familiar with what your breast looks like, what it feels like, so that when you notice a lump or any changes in size or in your skin configuration, then you should seek for help right away.
Hmm.
Sometimes breast cancer is so elusive, sometimes you don't even know it could manifest as the simplest way. It could just be a dimple on your skin and that's it.
Wow.
You know, sometimes it even goes with no symptoms, right? Sometimes it will just be like a lump, small lump, like a pinhead moving around. You touch it, you're like, oh, I haven't felt this before. Maybe I should check it out with my doctor. So, regardless of whether you're 50 or not, start
Hmm.
your start your breast exams. Every woman should start. I say, people in their 20s, 30s, even though it's rare in 20s and 30s, but every once in a while we find it as well, right? So just
Mhm.
start, even if it's just to get used to, how your breast feels and looks, and, being familiar with that, so that when a change occurs, you will be able to notice it soon enough for
Mm.
you to take an action.
Wow.
Um, yeah, so that's the other one. And then every year you should go to your doctor or your healthcare provider to have your annual check. And even if you're not up to the age of having that mammogram, your doctor should be able to do a breast exam, or your nurse or whoever who is
Mm.
you're seeing. So they use their breast exam is basically using their hands to feel the lumps or any changes. Very important too. So once a year you should do that, and then for your self breast exam you should do that once a month. Um, I
Mhm.
usually I usually recommend you do it at a particular time of the month. So maybe you use your period for those that are still seeing their periods, you know, um, do it, beginning of a period or end of a period, so that you know how it feels at that particular time.
Mm.
Okay, and then for others, just make it a habit. If you don't have any periods any longer, make it a habit and check every once in a while, once in a month. And when you're in the shower, the best time,
Mhm.
and to make sure that you identify any changes. And there are also videos of how to do that. If you search, I can share with Chinwe after this.
Okay.
How to do
Okay.
a breast exam on yourself. Yeah, and I think that's one of the most important things. And then when you get to the age, you start having your mammogram every 2 years, and
Wow.
that is at 50 for most countries.
Mhm.
Yeah, but if you have a risk, and if black woman and you think you have a risk, and you have a relative who has died of cancer, please start earlier.
Wow. Wow. That is so detailed. Thank you so much. And actually, we have a question that I think you answered most of it, but I'll still talk about the question. It's from Amaka Bailey. She's saying, are women of color more disposed to having dense breast or breast cancer? I think you touched it a little bit.
Yes. So women of color are more predisposed to having earlier breast cancer. But as soon as we get to 50, I think we see more in the whites and the Asians and the Jews. In fact, the Jewish women are the race with the highest rate of breast cancer in the whole world. Yeah, but one thing that we know and the literature says is that the premenopausal breast cancer is very common in amongst blacks,
Mm.
and then high density, it just depends on who, and genetic makeup. It doesn't really have to have anything to do with the race. We've seen high density breasts in blacks as well as whites, Asians, and
Mm.
all the other races. So anyone could have it. Yeah.
Wow. Wow, thank you so much. Somebody says here in the chat that Uzoma TV, she says, here in Italy, they start at 30 years to screen.
They start at 30 years.
30 years.
Oh, wow. That's
Yeah.
interesting.
Yeah.
That's interesting. Yeah. That's good, though, because for the blacks living there, that's a plus because you start
Mhm.
earlier. Yeah.
Mhm.
Yeah.
So I have my own question from what you have said. It's not on my list of questions for you. So since talking about the race, issues, people that have the race developing cancer disease. So would it matter if someone, let's say somebody gets breast cancer at 60 or 70? Does the risk reduce as one gets older in the black women or even what race?
Okay. So, um, Unfortunately, the risk increases as you get older,
Oh,
just like the risk of most cancers increase as you get older.
okay.
Because as we get older, our genes go through a lot of changes. Sometimes those
Mhm.
changes would result to different cell changes too at the cellular level, and so the risk for breast cancer increases with age.
Hmm.
Um, yeah, most of apart from the ones happening in the blacks, most breast cancers are diagnosed after age 50, and it goes on and on. A lot of our patients are in their 60s actually. Yeah,
Wow.
so the
Wow.
risk increases. And unfortunately, when talking about the risk factors that you cannot change, getting
Mhm.
older is one, being female is one. Even if you have surgery to reassign your sex, you're still genetically a female. So those are the two things that you know you cannot change. We see breast cancers in males as well. So
Mhm.
out of every 100 breast cancers diagnosed, one will be a man. So it's
Wow.
very low, very very
Mhm.
low. So being a female is a huge risk factor. Getting older is also a risk factor. But with the
Wow.
screening and all the measures in place, I think breast cancer is one of the cancers that have advanced, really well. In that we have, well, most countries have organized screening, and there's good treatment now. For as long as it's detected early,
Mhm.
the chances are that you would live a good quality of life even after your diagnosis. So,
Mhm.
but the key thing is early detection.
Wow.
Yeah.
Wow. Wow. Can I just use the opportunity to welcome all the viewers? Thank you all for coming. I've been showing your names because I know our doctor is running a tight schedule here. She doesn't have all the time, so that's why I'm just pushing forward to get this done so that I don't take 1 minute of her time that, beyond what she has given to us. Just like she explained that she's not paid for this, this is pure voluntary. She just want to make sure she's the one that she help us to get the awareness for October, So thank you, Doc, for doing this. And the next question, um, the next question is how often should an individual perform for itself? Okay, you've talked about it. Are you there? So
Yes. Yeah.
you've talked about it. So I'll just go to the next question. Um, I know you mentioned lungs. Are all the lungs cancerous? So every lump, when you feel a lump in the breast, would it or I
Very
don't know.
good question. Excellent question. And frankly, a lot of women, when they feel something in their breast, they get very anxious and scared that, oh, maybe I have a cancer. Maybe I have this. So, breast cancer is the most dreaded outcome for any lump in the breast. But there are so many other benign causes of a lump in the breast.
Mm,
It could just be cystitis, inflammation of the cyst there. It could just be mastitis, just breast, inflammation. It could be fibroadenoma. It could be anything. A lot of most breast lumps are benign. Okay?
mm,
Yeah, just a few, but because we know that cancer can be a serious thing, we take every lump serious. So if you see any lump, please wait. Don't get too anxious until you see your doctor and get that checked out. It may just be, cysts from previous years, maybe the years down the line when you breastfed your baby. Yeah, you never really emptied completely. It could also be an infection. It could just be, cellulitis. It could be so many other things. There are so many more benign causes of breast lumps, but it's still very important to rule out a cancer when you see a lump.
mhm.
So, but don't crucify yourself first before getting that confirmed. Um, yeah. So the message here is don't take any lump lightly. Make
Mm-hmm.
sure it is investigated, and then and don't just say, oh, okay, yeah, I've seen this before. Maybe it happens. It or it doesn't. I don't feel any pain. There's nothing happening there. Any changes at all that you notice in your breast. Some people will just start all of a sudden start having discharge from their nipple when they don't have any babies. You know,
Mm-hmm.
some people could start having bleeding from their nipple. Some people could just all of a sudden notice that their nipples is changing shape and direction. So all of those things, don't take it for granted. Get it checked out by your physician, and then after that, then you'll be rest assured that indeed it's not a cancer. And then if it's a cancer, probably in the early stages, there are treatments could be that that you'll be recommended for, and a lot of them still have good outcome. So don't be afraid. If it happens, the key is detecting it early enough. So as
Mm-hmm.
soon as you notice it, go and have it checked out.
Hmm. Wow, early detection is like the
Is key.
main bottom line. Yeah.
Yeah.
So I have a question, another question from the chat that says, does diet have any contribution to breast cancer exposure?
Yes. Yes. And I was going to talk to you about risk factors that you can change. So diet that is not healthy, right? So diet that is high in fat, not being physically active, not keeping a healthy weight. Of course, if you're not uh, eating a healthy diet, you're likely to have obesity, and your risk for breast cancer increases more than someone that has a normal weight. So, exercise is very, very important. Diet is very important. Maintaining your weight, maintaining a healthy weight is very important as well. So these are some of the risk factors that you can change to lower your risk of
Mm-hmm.
breast cancer. Yeah,
Hmm.
I can talk about other things. Alcohol too. You can. Alcohol increases your chances. Reduce alcohol. If you must drink, reduce it drastically. But staying away from alcohol completely will be the thing that we preach. But if you must, like, reduce your intake.
Hmm.
Um, and yeah, so the other thing will be some forms of hormone replacement therapy that include both estrogen and progesterone. Taking during menopause can increase your risk for breast cancer.
Oh,
So a
really?
lot of women in their 50s, yeah, if you're in your 50s and you're getting those hot flushes and seeing your doctor, they might, you know, suggest this to you to go on hormone replacement therapy. Um, uh, that will increase your risk, especially the ones with estrogen. That will increase your risk because we know that estrogen feeds breast cancer cells. So uh, check well before your doctor and make sure that that's what you want. If there are other alternatives that you can use, go for it. But hormones can definitely increase your risk.
Wow.
And yeah,
Wow, this is scary, because, I actually have a few people that I know that have done the estrogen kind of, um, I guess, the ones I know,
yeah,
they didn't do it because of it wasn't cosmetics. It was like for medical reasons, and
right.
it was recommended, and they chose that. So, but I
Yeah,
don't think that, like, recently I was just talking about it with a friend. I'm not sure that this issue of breast cancer was even addressed at all. You know,
yeah,
she was talking about other side effects, but not that. So this is
yeah,
really, really interesting that you're saying this.
yeah.
Wow. That's
They may
amazing.
not, and sometimes too, I mean, when women have those symptoms, they are desperate, right? Because they are desperate
Mm-hmm.
for treatment, and the doctors will now lay all the cards on the table and say, okay, choose one, you know.
Mm-hmm.
And that at that time, you're just desperate to have your menopausal symptoms resolve, and not necessarily thinking about the long-term effect of exposing yourself to estrogen, right? So,
Oh my God.
um, yeah, so that
Wow.
is, I personally don't recommend that at all. Yeah. There are so many other
Wow.
ways that you can manage menopausal symptoms.
Mm-hmm.
Yeah.
Yeah. Wow. Wow. Eye opener here. Thank you so much, Dr. Achebe. Um, I said to you, we're not going to take a lot of your time. I'm almost at the end of my questions. And I want to ask you, if someone is diagnosed of breast cancer today, what would be your best advice for them?
Oh, okay. So my best advice to them is to, first of all, I'll have to calm the person down. That's part of my role as a doctor, right? I'll need to calm
Mm-hmm.
you down. Um, let the person understand that it's not the end of the world. I usually like to share numbers, statistics. Um, like I mentioned earlier, if a breast cancer is diagnosed within the stage 0 and stage 3, 19, there's a 99% chance of surviving for the next 5 years and even beyond.
Mm-hmm.
So, breast cancer is one of the cancers that have been researched thoroughly. The research is still ongoing. Every, every, every day we hear about new advances in breast cancer treatment. So I'll, first of all, reassure my patient that this is not the end of the world.
Mm-hmm.
Let him or her know that uh, the chances are that she will make it. I know a lot of survivors, and I'll provide my heartfelt support, encourage her to take all her treatments um, religiously, because that's very important.
Mm-hmm.
And then I know breast cancer patients benefit from support groups. We have support groups that comprise of survivors, and that has really helped a lot of breast cancer patients. So once
Mm-hmm.
I introduce them to that group, they meet nowadays with the COVID. They meet virtually and they tell their stories, and and then the new cases get very feel very positive that they would have this outcome. So these are the things. I'll provide all the support I can to make sure that her journey is as smooth as possible.
Mm-hmm.
Yeah. So, and of course, make sure that she complies with everything her oncologist says with the treatment and going forward.
Wow. Because
Yeah.
I guess it's not an easy news.
It's not.
It's
It's
like
not.
hearing that you're going to be killed, or it's like a death warrant.
Yes.
Although, in this case, from what you've said, most breast cancers, if detected early, it's,
Yeah. I mean,
yeah.
if it's a stage 4, for example, stage 4 is quite late in the course. My approach will be slightly different. I'll still reassure the person. We've had a few stage 4s that have made it. But I'll urge the person to do her own part, and the doctors will do their own part, and then we'll see how things go. Yeah, so reassure the person and encourage the person. It's not an easy journey at all. It's not.
Hmm, can
Yeah,
imagine. Can imagine. So that is part of the reason why awareness, it's really, really key.
very. Yeah,
Because I know the saying that my people perish because of lack of knowledge. If we know some of the things like, we had this session before, and like personally, I've gone to several breast cancer awareness, training and speeches and all of that. But some of the things you said today are even new to me. So you can imagine that in my opinion, anywhere anyone hears about breast cancer awareness, it's really good to key in and listen and learn because knowledge is every day. That's what I think. And I
Yes.
really, really appreciate that you have opened our eyes even the more to prevention because that is your specialty. And telling us what to do, what not to do, I think is the best step. So I remembered that you mentioned in one of your when you were talking answering some of the questions, you had talked about sending the link for how to do the self-examine.
Yes, I will do that.
Self-examination. So you would send it to me, and I'll drop it in this comment section for the viewers to take a look if they want to access it, so they can take it and use it.
Hmm.
So I don't know if anybody else in the chat has any question because our doctor will be taking a leave soon. So if you have any question, drop it before she goes. Let's see. So thank you all. And if you're here, you have not remembered to give us a thumbs up, please, please, please. You can give us a thumbs up. If you're using your phone, just a little one more step backwards. You go back, on your phone, one step, and give us a thumbs up, and then you can come back into the live. So don't forget to give us a thumbs up, and this we really, really appreciate it. And thank you all for coming today to listen to this session. And I hope that you have benefited from what our expert has to say on prevention and actions that we have to take so that we don't end up reacting to it. You know. Although, doctor, one more question for you. So after, would you guys? I'm sure. I'm just guessing. I don't know. Would you have incidents of people who have obeyed all the rules, exercised, ate right, done everything on the board, on the chart, and they still end up with this deadly disease?
Yes, there's actually 15%
Oh my gosh.
of people who can have that. 15% of people who have breast cancer that don't have any, like, they've obeyed all of that, but because they are genetically prone,
Mm-hmm.
yeah, it's it still happens, unfortunately, but still, early detection is key, right?
Yeah,
If it's
even
caught
in this.
early, yeah, early detection is key in those. So there's still, unfortunately, there's still an incidence. It's about 15%, but the remaining 85% are due to things that we can
We
we can
can,
control, right?
yeah.
So yeah. So there's this particular gene, BRCA1 and 2, that is linked to breast cancer and ovarian cancer.
Mm-hmm.
So if if you have it in your family, some people actually go out of their way to, test for it, especially if you've had one or two people in your family with breast cancer and ovarian cancer happening, your doctor might say, okay, we might let's check you for this gene, and if it's positive, then some, you can do something. Some people have opted to do a mastectomy in their 30s because they have that gene and they're scared that they would have breast cancer. But
Mm-hmm.
because with that gene, I believe it's almost like 75% chance of developing any of those cancers, so it's quite high.
Mm-hmm.
Yeah, it's quite high.
Wow.
Yeah,
Wow. What a
unfortunately.
deadly disease.
Yeah,
It's like a monster,
it is
you
a
know,
monster. It is a monster.
you know,
Yeah.
because even the fear, when somebody gets diagnosed of this disease, I guess even okay, or would I ask you this question, the correlation between stress, being stressed and getting breast cancer, is there any connection there?
Well, stress is a precursor to a lot of cancers, right? So, I
Okay.
mean, yeah, stress, you know, um, increases your chances of having those cellular changes, which could result to cancer. So stress is not good, no matter how you look at it. Yeah.
Mm-hmm.
Yeah.
Wow. Wow. Thank you so much.
Yeah, it is. I'm glad that we have a lot of women joining us today. I hope you've learned a lot. Breast cancer, even though it's deadly, is the commonest cancer killer amongst women. But the key, a lot of people that we find dying from it are people that never really took their screening seriously. They never took their
Mhm.
mammograms and other things, and even their breast awareness, breast examination seriously. So I'm believing that the women joining us today would help to spread the word. It's preventable, and early detection is still key. A lot of the individuals dying from it are people that were found very late, and by the time it's in stage 4, it's already spread to the neighboring organs, the liver, the kidneys, the heart, and there's not much one can do anymore. The lymph nodes, yeah.
Hmm.
So yeah.
Wow. Scary. Thank you
Mhm.
so much, Doctor, once again. And we really appreciate your time and the knowledge that you imparted to us today. And hopefully, we can request for your honor to come back to this channel and share more information, preventive information to the viewers here, because this is what we want to do. We want to help people to stay healthy as much as possible. At least let's do our part and leave the
Mhm.
rest. So somebody is saying thank you very much. Amaka Bailey is saying thank you so much, Dr. Achebe, and we really appreciate you a lot for
You're
coming.
most welcome. You're most welcome, and I'll be pleased to come back again to talk on another topic.
Okay, thank you
Yeah.
so much.
Yeah.
So I'll get the link and I'll put it here for people to be able to learn how to do the self-examine, because I tell you what, it was, even for me, it was one difficult thing to actually start mastering how to recognize the feel of your own breast and what to be looking for, and to make sure that, because sometimes when you examine yourself, you don't really feel anything, you don't really
Yeah.
kind of understand it. So I think it will be very beneficial for people to see how to do that.
Sure. I will
Yeah,
send that across to you.
thank you. And
Right.
thank you once
Thanks.
again, and blessings to you. And I'll let you go.
Thank
Then I
you.
will just finish up with the
Bye.
audio. Thank you so much. God bless.
Bless you
Thank
too.
you. Hello. So thank you all for coming today, and we are going to be closing now. So I really appreciate all of you that have come here, whether you were in the chat or not. If you were watching us from home, please just give us a thumbs up if you can. And I appreciate all of you watching, coming to our live streams to support what we do, because what we do is just to bring the little knowledge to us. It's like a reminder for us to remember, because some of these things we can easily just forget to do them. But this channel is for us to be reminded, that these are necessary things that we need to do. So we'll be closing now, and I thank you all again for coming to support this live stream and for watching it. Thank you all, and you all stay blessed. So we're going to be calling it off now. Bye for now. Unless you have any more questions, I'll be ending the broadcast. Stay blessed, everyone. Thank you. I'm well, Chef Prem. I'm well. Thank you. Bye. Bye, Sarah King Kitchen. Thank you all. We'll connect soon. Bye. Francis is saying bye. Bye, Rosuzama. Yeah. Thank you all. Okay. Bye for now. Amaka. Bye. Chef Francis was that. Thank you. Thank you. Okay. Bye all.